Welcome to the Food Clues podcast, where we dive deep into the world of holistic health and wellness, conquering your food allergies and intolerances one bite at a time. I'm your host, Dr. Alexis Sams, holistic physical therapist, food allergy specialist, but you can call me the food allergy doc. With this podcast, I'm all about helping you conquer your food allergies naturally. Through my unique Food Clues treatment approach, I've helped hundreds of people uncover the root causes of their food reactions and achieve true freedom from allergies and intolerances by identifying the missing links between their trigger foods and the underlying causes driving those triggers. In each episode, I'll be sharing the latest in my holistic health practices. I'll also be sharing transformative success stories. I'll bust some common myths surrounding healthcare and food allergy management and provide practical tips to support your healing journey. Whether you're struggling with chronic food allergies or looking for natural ways to manage other symptoms and enhance your well-being, this podcast is for you. Today's episode is packed with insights and actionable advice for better health that's right up your alley. So let's get started on the path to a happier, healthier you. Welcome to the Food Clues podcast. I'm your host and equal opportunity eater, Dr. Alexis Sams, the food allergy doc. And today I want to talk about something that I've actually never really discussed on the podcast, and that is the transition into your new life as you experience less reactions to former food triggers that have been diagnosed to you as allergies or intolerances. So this episode in particular is for those of you who have spent like years or a long period of time with a limited or restricted food routine, limitations in activities, contact with friends and family, all due to your food reactions. But you've gone through the healing and now you're on the other end, finding yourself able to tolerate more foods and also interact with more people and places. But you might feel a little nervous or lost in how to navigate that new freedom in your life. And to help me talk about this, I have on the show today one of my near and dear friends, Dr. Marci Madruga. Marci is a licensed doctor of physical therapy and certified functional medicine provider. She helps her clients find their most optimal health by using a combination of epigenetics, which she'll explain, simple nutrition, simple supplementation, and exercise. Most recently, she's added neurolinguistic programming and hypnosis to her practice. And that allows her to better support her clients through mindset shifts that can keep them stuck in fight or flight or in identities that no longer serve their highest good. Marci and her husband have twin boys. They're super cute, and they enjoy all that Colorado has to offer them. So welcome, Dr. Marci, to the show. How are you today?
I'm doing well. How about you?
I'm doing great. So for those of you guys who don't know, like Marci and I, we're both doctors of physical therapy, and we've been friends for years navigating the healthcare world and finding ways to better serve our clients in a way that truly fosters their natural growth, their natural conquering of whatever challenges they may have. So the first thing I want to start off with, Marci, is just to have you tell us a little bit more about your particular journey from traditional physical therapy into functional medicine.
Yeah, it's not, I think it's a story that a lot of people have. I was a physical therapist who primarily treated low back pain patients. And after my twins were born, I had a little bit of back pain, and I had had a history of back pain because I was in a very traumatic car accident when I was 16, and it had like kind of flared up, gone away, flared up, gone away. But after the twins were born, it just kind of stuck, and I couldn't get it to go away. And it didn't matter what I did. I tried all of the tips and tricks that I give my back pain clients. I went through the whole program that I do with somebody with figuring out, okay, which motions help, which motions don't. And went through like the post-surgery into like getting back into athlete program that I give people, and nothing helped. And so I finally scheduled an appointment with my primary care doc to try and get a referral to a rheumatologist because there is a large history of autoimmune disorders in my family. And when I scheduled that appointment, she walked in the room. She never looked at me. She never did a physical exam. She was typing in her computer the whole time. And she asked, if there were any concerns that I had. And I said, well, I see a lot of your clients for back pain and I help them and I can't help myself right now. And so I'm worried that there's something bigger going on. And I don't do well with pain meds. I don't do well with muscle relaxers, and I can't even take Tylenol without getting an upset stomach. So I don't think that that's the route I want to go. I want the referral. And her response was to prescribe oxycodone, tramadol, and Mobic, which is an NSAID. So she prescribed all the things that I can't take, right? And then she did write the referral to the rheumatologist. And I was able to go and see him a month later. And this again was somebody who referred me clients all the time. He knew my name, he knew who I was when I walked in. And I told him a little about what was going on with me and said that I was concerned because of the family history. And he said, okay, well, let's try this medication and see what it does. Then I was like, wait, what? What do you mean? Like, what testing are we doing to find out what's going on with me? And he's like, none. We're going to inject you with this medication today. We'll follow up with you in a week and see how you're doing. If it helps, great. If not, we'll schedule another appointment to come in and try a different medication. And we'll just keep doing that until we figure out which one works. And then we'll give you a diagnosis. And I was like, well, there's no blood work. I know there's genetic testing that can be done for things like rheumatoid and things like that. Like there's no x-rays you're taking, nothing, none of that. And he's like, no. And I was like, well, I've been reading some stuff in the research about inflammatory diets and how we can change nutrition, and that might change some of it, especially if it is autoimmune. Like, how do you work with those clients? And he's like, look, you can do this my way, or you can get the F out of my office. Only he said the whole word. And my husband was sitting there. And my husband was like, let's go. So then I kind of got left on this island of figure it out yourself. And I started digging into the research. About 6 months later, got a referral to a hematologist who was willing to do all the genetic testing. And the only thing that came back was, okay, you have this MTHFR allele mutation, but I don't know what to tell you to do with that. All I know is I think you're on the right track. Don't do medications. Keep going and doing what you're doing. So I kept digging in and I found at first it was I forget what I think he calls it, the functional medicine something. I forget what it is. Anyway, James Maskell was doing these talks around the country and he wrote this book called The Evolution of Medicine. So I started there and I read that book. And then I got attached to listening to podcasts between James Maskell and Sachin Patel and really started just piecing it all together, and then kept going that direction and was starting to feel better and starting to feel better. But I still had like 35 extra pounds of weight on my body that I couldn't get rid of, even though I was doing all the perfect things. And then in 2020, when lockdowns happened, it freed up some time in my physical therapy schedule, obviously, because people weren't coming in for in-person sessions because things like knee surgeries and back surgeries had been canceled. Um, and I started taking a class on functional genetics. And part of that was getting my own genetics tested. And that was kind of the tipping point where I was like, oh, well, this is what that means. And this is what I need to do about it. And this is how I can help myself. And followed that genetic protocol. And in 6 weeks, without trying, without really changing a whole lot about my nutrition, changing nothing about the way I was exercising, I literally took out 3 foods. That's it. 3 foods out of my diet. I lost 36 pounds in 6 weeks without trying, and all the pain went away. Then I was like, okay, we're on to something. But it took 7 years, and I don't think it should take that long.
Yeah, 100%. So, just to kind of piggyback on what you said and take it a step further, can you explain how? So, when I introduced you, I used the term epigenetics, and I said that you were going to kind of explain that. So, can you talk about the difference between genetics versus epigenetics, and then maybe how our exercise and nutrition kind of factor into that, using those four factors as like the gateway to, like we said, that newfound freedom after we've conquered some of our food challenges.
Yeah. So the epigenetics are the part of your genes that you can manipulate by your environment. So those are the genetics that you have control over. So it doesn't include, like, say you have the BRCA gene. that is not an epigenetic genetic that you can change by based on your environment. You can do some things to lessen the risk of getting a terminal breast cancer, if you have the BRCA gene, but you will still, it's like 80% of people with the BRCA gene end up with breast cancer, regardless of what they do. But it's things like how well your body processes fats, what time of day you should exercise to get the best results out of it, the MTHFR genetics and all of the other 6 genetics around methylation that you can manipulate through vitamins, through supplements, and through the foods that you're eating. Things like how well your body converts vitamin D from the sun is also something you can manipulate, and people don't really understand that. So it's those things that we can change, and we can also get an indication of really what is the best diet for you. And so that nutrition plan can still be very varied, but if you're following a specific protocol, so for me, my epigenetics say that I need to eat a low fat, high protein style of diet that is more Mediterranean. So I need lots of color and lots of variety in my fruits and vegetables, but I shouldn't be eating things like bacon because it's higher fat. Does that make sense? And part of that is because my body doesn't mobilize lipids well, which means that I'm in that like 8% of people who naturally have higher cholesterol. And if I want to be able to manage that appropriately, I have to eat a diet that's low fat. Your epigenetics can also tell us how much exercise and how intense you need that exercise to be in a week in order to mobilize your fat stores to maintain a healthy body mass index. And I don't like BMI as much as I like waist to hip ratio and also your lean mass compared to your fat mass. But that's what everyone talks about is BMI. So just to keep that kosher with everyone else.
So would I be on the right track if I said that um, getting more information about your genetic, your epigenetic profile in light of now having these, lowered food reactions in a new almost lease on life, you're saying that that could be pivotal into helping you navigate that newer lifestyle in terms of things that could be a little bit more appropriate to eat to keep you moving forward in your health journey or different ways of exercising again to keep you moving forward. Is that what I'm hearing?
Yeah, because if you think about the conversations that I've watched you have with other people, conversations we've had in the past, and you end up with like vitamin and mineral deficiencies, enzyme deficiencies, acid variances in the body, right? If you're not eating the foods that are appropriate for you genetically, you're going to end up with those same imbalances again, right? So if you can know what foods are the best foods for you and eat those and only some of the other ones, like I'm not telling you I never eat bacon. I eat bacon probably once a month, but I don't eat it every week or even every day because I know if I do, I'm going to start gaining weight again and have inflammation and have pain again. And incidentally, have more reactions to foods because my body's then struggling to get rid of this other thing. So it's just another way to help support that long-term health piece where even as you're getting back into foods, your clients already have this guide of, okay, well, here's the things I can do to adjust to get back to where I need to. But what if you never got back there in the first place? What if you could just say, Dr. Alexis helped me, I did the work, and things are going great, and I'm going to keep them going great.
Yeah. So, in that, let's talk about as they continue in that transition into the new life. Let's talk about overcoming some challenges in that part of the journey. What are some of the common challenges that you feel like clients or people in that position would face as they're transitioning to that healthier way of eating, that healthier way of exercising, and what kind of nuances or differences do you see um, yeah, that might be kind of existent in that stage.
One of the biggest ones I see, and I'm sure that you have this conversation with clients too, is that they've become so reliant on caffeine first thing in the morning to get them through the day that they automatically spike their cortisol, which means that they're spiking their insulin. and then they struggle throughout the day. So one of the biggest shifts that I ask them to make is to actually eat within an hour of waking up. And the research shows that if we can get them to get 30 grams of protein in within the first hour that they're awake, they will maintain a healthier body weight and inflammation in their system for a longer period of time. And the most common response I get is, I'm never hungry when I wake up. And that is a low stomach acid issue, which could then lead to food triggers again, right? So we want to get them to where their digestive system is waking up and ready to take in food. Because when they say breakfast is the most important meal of the day, it is, because it helps your body maintain appropriate cortisol throughout the day, which helps you then be in a fat burning mood instead of a fat storing mode. So
And
that's one of the biggest ones.
yeah, it's a side note. We had that conversation a couple weeks ago, um, and I started doing it. So I pushed my coffee back a little bit further. I wasn't doing it first thing in the morning, but I was doing it a little bit sooner than I should. So I pushed that back, and I started drinking more water in the morning, like I know I should, and getting that protein in. And I am starting to notice differences in just one. It's definitely helped my like digestion and elimination. I didn't really have like energy issues before, but and I might not even have the words to describe it. I think I just feel like I'm on a healthier track. And I'm still going through my cleaning out journey, so I'm kind of like double dipping. But I've definitely kind of noticed a turnaround, and I like the fact that it's helping me to establish a healthier habit, so that when I do finish the healing part, I've already got things in place to kind of really uh, take me to the next level. So we're going to shift gears a little bit and talk about that mindset component that you recently added, which I love. You recently completed a certified hypnosis certification program.
Yes.
Talk about, in your own words, how do you feel that mindset plays the role in achieving that long-term success in that transitioning from my life is so isolated, my life is so small, I can't, eat anything, I can't be around people, to now my world is more open to me. I can tolerate the healthy things that I'm supposed to be eating to support my genetic profile. They don't tear me up anymore. How does mindset like factor into all of this? And can you talk a little bit about how maybe some of the work with your clients, how you've seen some changes to keep them moving forward?
Yeah. I think particularly as women, we get labeled a lot, right? And you get labeled as the difficult eater, and you get labeled as the person who never wants to do anything, and you get labeled as the party pooper, right? When you have food reactions and food sensitivities, and really you don't want any of those labels, but you start to identify with them because it makes it easier to just say, well, I already have this issue. Let me just make my own thing and bring my own thing, or eat before I come, or I'm not going to eat when I get there, or, and so you don't realize that you're identifying with that, but you're taking on someone else's identity of you, or identification of you, and some of the attributes of that. And one of the things they say, even in business, is that one of the hardest shifts that you will make is from the person you are today to the person that you want to be. And I see this a lot too in people. In the weight loss program that I run, one of the people that I was working with, her comment to me at the very beginning of the program was, I've always been a big person. And I was like, have you? And she said, yes. And I said, I thought you told me you were a preemie. And she's like, I was. Then I was like, okay, well, then you weren't big. Then she was like, what? And I said, you have not always been a big person. Why are you saying that you've always been a big person when you were a preemie in the NICU because you were 3 pounds when you were born?
Mm.
You have not always been big. You have just taken on this identity. And so now we need to figure out why and how it has served you, and also how it's no longer serving you, so that you don't have to be a big person anymore. And part of that is unraveling some of those traumas that have happened. And I'm surprised to see how many of my clients that trauma is related to either verbal or sexual abuse, unfortunately. And I mean, one of my clients is in almost 80. She's a very healthy weight, but we're working just on mindset pieces because she has a very negative self-image of herself because she watched her father continuously criticize her mother for her weight.
Mm.
So she was afraid to eat, and she was trying to do all of these activities, including at the age of 78, teach an avalanche safety course out in the field, and she passed out. So we're working on just the identity of it's okay to nourish my body and be a healthy weight and be nourished. And those shifts, I think, are really important to make because if you say the person that says, well, I've always been allergic to, or I can never eat, or I can never be, or I'm the difficult one, you will always stay that person instead of becoming the person that you want to be now that you're done with that.
Yeah, yes. And again, that's why taking those steps to not just physical healing, but mental, emotional, and even spiritual healing is so crucial. So let me ask you this next. What do you feel like is kind of like at the top of your list? I might not say like an ultimate number one, but what's near the top of your list for not feeling so overwhelmed with that transition, especially from the mindset perspective? And then what is at the top of your list for making these new mindset and new eating and social habits sustainable?
I think the first thing, and I tell my clients this all the time, when you're, like you said, I'm still going through my clean out phase. That doesn't have to be overnight, right? Like, so the things that you are removing from your life, you don't have to go get a dumpster and put it in your front lawn and throw everything out of the house. Because number one, it's not financially responsible. And number two, it's going to make you feel so overwhelmed that you get paralyzed and probably just rebuy all the same things. So I usually tell people to make one shift at a time. So if it's something simple like um, uh, when somebody said it finds out that they have celiac disease, or finds out that their child has celiac disease, I'm like, start with one thing. Don't, like, what is the one thing that that child eats all the time? And let's find the healthiest version of that they will continue to eat that is gluten-free. And then they're like, okay. And I'm like, and let's make it so the whole family can do it. So the child doesn't feel isolated. So it has to be something that tastes good, right? And so sometimes we'll start by replacing it with something that's like maybe not the healthiest, but then switching it to something that's healthy along the road. But it's the one thing at a time. Because when you do, like, if you uproot a 7-year-old's life and say you can never have, it's going to hit the fan, right? We
Mm-hmm.
as adults still have a 7-year-old inside of us. So we have to think along those same lines of one thing at a time. And the mindset shift pieces, the biggest thing that I think, again, like it's one thing at a time, right? So if it's just saying, I'm content today, not I'm happy, because you don't have to be happy because that might not be where you actually are, but saying, I'm content today. And one of the ways that I have people focus on that is I have them write themselves a letter as if it's a year from now, complimenting themselves on 5 things that they have accomplished in that year. Because then it's like I have these goals, but I give them a prompt with it that's like the prompt is actually 4 pages long and it's like 39 questions that I want them to answer in detail. So I ask more questions, what happens when you wake up today? Who's laying next to you? Is it cold or is it summer? Is the sun shining or is there clouds? Are the windows open or are they closed? What do you do when you first wake up? Is it a shower? Is it brushing your teeth? Is it going and have them like walk themselves through that day a year from now and congratulate themselves on all of those things. Because it makes it easier for them to see that whole picture. and understand what it is that they actually want.
Yeah, and if they can visualize what they actually want, then they can take those steps and appreciate those steps more, to
Yeah.
make them more sustainable. I'm going to backtrack just a little bit because I want to talk to you, or I want to ask you about a hot topic,
Yeah.
um, that I know you are passionate about, and I know you have a lot to say, and I want the listeners to hear about it from your perspective. And that topic is fasting. I know you love talking about fasting. Um, there's so much, it's almost like a buzzword, it's almost like a trend, it's almost like it's the cool thing to do now. But you and I both know, that there are some really strong considerations from a health perspective, that should be looked at to evaluating whether it's safe for someone in total, or if it's safe at one time or another. So I'm going to kind of throw this to you and give you the opportunity to tell us, like, the Dr. Marci breakdown of fasting, like do's and don'ts for, again, best health, especially, like I said, this episode being for that person with this new lifestyle of what they can, where they can go, what they can eat, and things like that.
Yeah. This is one of those topics that, oh man, people hate me for this, and that's okay. Because this is all based out of the research.
And that's
Uh,
exactly why I wanted you to talk about it. So go.
the research on longevity shows that you should be eating in the morning, not eating at night. And the reason you shouldn't be eating at night is because when you eat later in the day, you increase pressure on things like the sphincter between the stomach and the esophagus, and you have a higher chance of ending up with regurgitation of food into the esophagus, even if you don't have issues with stomach acid. Um, and so that's one of the reasons that most people are doing fasting wrong. And the other thing, like we talked about before, if we're trying to rely on energy and fuel to support our body instead of cortisol, which spikes insulin, which insulin is a fat storing hormone, then we can't fast in the morning. We have to eat in the morning. And we have to eat before we have caffeine. Because if you have caffeine first on an empty stomach, you still spike cortisol, which spikes insulin. So you're still storing fat. On top of that, we have people who are have things like PCOS with insulin resistance, and people who have PCOS without insulin resistance, right? And we have people who are diabetic who are insulin resistant. And their fasting needs to look a little different. So if you have insulin resistance and your body cannot maintain a stable blood sugar level, the longest fast that you should do, true fasting, if where no calories are being taken in, is 12 hours. And part of that is because of the way that the hormones leptin and ghrelin are made. Um, but no one, as an adult, needs a snack, even if you're diabetic. And in fact, especially if you're diabetic, you should not be having a snack because insulin resistance is the problem. Every time you add a calorie in, you spike your insulin. The cells still can't absorb it, so you just end up storing fat. So that's part of the problem, even with what the American Diabetes Association pushes out, is they're like 5 to 6 small meals a day. And I'm like, are we trying to create more insulin resistance? That it doesn't even make sense if you understand the science behind diabetes. And then on top of that, if you're a female, during the week of your cycle, you are losing so many nutrients through the bloodletting of losing the lining of the uterus that fasting is contraindicated. And in fact, will cause your cortisol to spike. And if you were monitoring your blood sugar, like if you're wearing a continuous glucose monitor or you are testing it post, I have some clients that'll do postprandials every day because they've had PCOS or been told they had PCOS when they don't have it, or some kind of thing that's made them think they need to check their blood sugar more regularly. You will find that your insulin resistance during the week of your period is higher. And that's also why you tend to crave more sugary things during that week. So fasting during your cycle is contraindicated. And again, the longest fast that should be is 12 hours. When we look at the research behind what does fasting do in the body and like killing cancer cells and getting into an autophagy stage where you're actually breaking down the not good things in your body, you need to get all the way to a 17-hour mark before any of that starts happening. So if you're only fasting for 16 hours, you're missing the point of fasting. And there's research from a couple of the different longevity studies and also the twin study out of the United Kingdom, which has 3,600 sets of identical twins that shows that fasting for 72 hours is better than fasting every day for 17 hours for the heart.
Oh, wow.
And then on top of that, Dr. Longo out of Italy has proven that you can do a fasting mimicking diet for 5 days and get the same benefits that you can do if you are trying to do a 3-day fast. So if we have somebody who is an insulin dependent type 1 or type 2 diabetic who's trying to lower their risk of heart disease, cancer, etc., we can have them do a 5-day fasting mimicking diet and get the same results that we would out of a 72-hour fast. The benefits of fasting include things like it's anti-aging. You can lose weight if you're doing it appropriately, but again, you have to get to a 16-hour fast, which means that if you're getting up at 5 o'clock in the morning, you need to eat by 6 a.m., which means that you need to be done eating around 2 to 3 p.m.
So, go ahead, you finish.
So if you're not willing to give up dinner with your family and you want to eat that meal with them, something like the fasting mimicking diet once a month might be great for you because then you can have it's a bowl of soup, but you're still eating with them.
Yeah. So what I'm hearing and pulling all of that together, because like I said, I know you're passionate about it, and we could have a whole episode, and we probably should, just about that. What I'm hearing is that the way that fasting is portrayed in media and general information outlets probably isn't the full picture, that fasting is unique to your like current health status, and that might change depending on what's going on in your health. And best practice is likely working with someone like Dr. Marci, who has a more naturally body biologically aware basis and foundation for the details of fasting, so that you can know what works best for you and implement that, and not just randomly stop eating and hope that that's going to be the solution for you, which a lot of people do. So um, I encourage you guys, to listen to that part again. It was chock full of information. But at the minimum, just know it's not just not eating anything. It can have its benefits, but it needs to be appropriated for you and the current state of health that you're in. So thank you for that. I really appreciate it. And as we kind of wrap things up here, why don't you give kind of like your biggest takeaway that you want our listeners to remember about navigating that transition to more foods, more activities after going through almost like a lifetime for most of my clients, a lifetime of restriction, a lifetime of isolating. What's the biggest takeaway that you want listeners to remember?
I think that the biggest thing is that every transition looks different, and you are not the same person as me or Dr. Alexis or your sister or your cousin who may also have food allergies, sensitivities, etc., that they're trying to work on getting rid of. And that you've had this experience that has been negative with something for so long that it's okay to be nervous, but don't let that stop you from trying, because that will keep you partly in that identity that you no longer want to be in and keep you from moving forward and experiencing new things.
Beautiful. And then finally, how can listeners learn more about you and your work? We're going to put your links and everything in the show notes, but if you want to go ahead and share those here and let us know about any like flagship programs or anything that if somebody's listening and they're like, hey, I might want to work with Dr. Marci, what might that kind of look like?
Okay. Um, so obviously my links, I'm on TikTok at 5280 Restorative Med, on Insta, well, depending on how long that lasts, on Instagram at dr.marci.cm. And my website is 5280restorativemed.com. And those are the easiest ways. You can also email me, Dr. Marci, at agilityphysio.com. My new offering for 2025, I'm doing an annual membership, and the annual membership includes blood work twice throughout the year. And after we get that blood work done, we look at what's going on in your system. If something needs to be supported, we give you a plan to support it, and we kind of set your plan for the next 6 months. And we have regular check-ins weekly via text message. There's text message support throughout through my app, which is HIPAA compliant. So it's not like a Facebook platform, anything like that. It's very private. No one else gets your data. And then I offer the metabolic reset, where we do a full liver detox and gallbladder flush. Especially people who've had a lot of sensitivities have got a lot of inflammation in that liver. So we clean that out. The liver holds 40% of your immune system in it. So we want to really support your liver health. And it makes it a lot easier to lose weight when you clean out the liver too. So we do the metabolic reset directly after the liver flush. And we do genetic testing in there so that we can, again, set your genetic plan for what happens for the rest of life after you're done with the metabolic reset. And then the other program that I offer is really for people who've had a lot of autoimmune issues. It's kind of a year-long, full, big detox slowly of each system. There are some people who get through it in 6 months. I've not had someone do that recently. It does usually take a year because, again, we're slowly moving through the process. Rushing through a detox is not the way you want to do it. That'll just cause flare-ups of symptoms. And for anyone who's watching this, I do have a code that is it's Dr. Alexis 25 for 25% off of any of those programs. And I'm also offering for any of Dr. Alexis's clients 25% off the consultation. So you can use that same code if booking an appointment with me, and that will get you 25% off.
Awesome. Thank you so much. I actually didn't know you were going to offer that. So thank you. Yeah, so that's all we've got for today. Thank you to Dr. Marci for being on the show. This concludes today's episode of the Food Clues podcast. And remember, every food you avoid is a clue to your health. Unlock your food clues and step into freedom from food reactions and chronic symptoms for your best life yet. See you next time, guys. Thanks for joining me on this episode of the Food Clues podcast. I hope you found today's talk insightful and inspiring as you navigate your journey towards better health and wellness. Ready to take the first step in conquering your food allergies? Visit www.myfoodclues.com/quiz and take the Food Clues quiz today. In less than 5 minutes, you'll get your first food clue to identify the likely causes of your food reactions. This will be your first opportunity to uncover the hidden factors impacting your health and start your journey towards food freedom. Stay connected by following the Food Allergy Doc on Instagram. Enjoy the Food Allergy Freedom Collective on Facebook, where you'll find a supportive community and valuable resources to help you on your path to wellness. And don't forget to subscribe to the Food Clues podcast so you never miss out on an episode. If you enjoyed today's episode, please leave a review and share it with someone you know. Thanks for listening, and remember, your food clues are the key to conquering your food allergies. Take the quiz, join our community, and let's achieve food freedom together.